What do you tell your patients about flu vaccination? It's the season to get it. The vaccinations are available. What's your advice?
My advice is absolutely to get it. It's the best protection that we can provide ourselves and our children. And even though there's been a decrease in cases with the social distancing, masking that we've been doing since March 2020, there is reduced population immunity, so that increases possibility of having a more severe and early influenza outbreak.
Is it safe to get a flu shot and a COVID shot in one sitting?
Absolutely. And I usually recommend that people get both. Just get one and done, or two and done.
And one can't protect from the other. You can't get cross protection from COVID by getting your flu shot.
Exactly. They're completely different vaccines.
If somebody's experiencing symptoms, and the symptoms of these two ailments can be very similar, is there a way that I as a patient can distinguish, well, this feels like the flu, or well, this feels like COVID? Is there a way for me to be certain or sure without getting a test?
I really wouldn't recommend that people try to distinguish the two, because it's hard enough for healthcare providers to try to distinguish it. One of the symptoms that is common of COVID-19 that we don't really see of the flu is the loss of taste or smell. But I wouldn't rely on that alone, and I do recommend that people get tested. We are frequently testing people for both. I know the CDC is as well, just to get that surveillance data.
Is it possible to contract both diseases at the same time?
Yes, we have seen that among hospitalized patients. So obviously having two different viruses can overwhelm our immune system and cause more severe illness.
When patients come to you asking about the flu vaccine, what concerns are they expressing about whether they should get it? Are they expressing concerns for their own health or for their children's health?
So the most common misconception that I hear is, I got the flu vaccine last year or whenever, and then I got the flu. That's not possible, because these flu shots are inactivated or weakened forms of the virus. The other concern is that getting both of them together might overwhelm the immune system, but in an otherwise healthy person, our immune system can deal with getting the two immunizations. And like I said, we actually recommend getting the two to get the best protection.